Good afternoon, everybody, and welcome to the December meeting of Leeds City Council Executive Board. Welcome everybody in the room and people watching online. Just before we get onto the agenda, just to say that Councillor Andrew Carter has submitted his apologies for today's meeting, and Councillor Alan Lamb is attending in a non-voting capacity, and Councillor Jonathan Pryor has submitted apologies as well. So I'm going to move on to the agenda. Gerard, are there any appeals against refusal of inspection of documents?
Thanks, Chair. To confirm, we've received no appeals for today's meeting.
Thank you. Can you update us on the exempt information, please?
Thanks, Chair. Should the board be agreeable, the following is to be considered in private at the conclusion of the public part of the meeting. Appendix B to item 13, which is Wetherby High School rebuild proposals and business case, designated as being exempt from publication, and the appendix to the late item of business entitled West Yorkshire Devolution, consent to non-transport borrowing powers, designated as confidential.
Thank you. Are there any late items, please?
Thanks, Chair. With your agreement, the following within your portfolio have been circulated to board members for consideration as part of today's meeting. First, a late item entitled Update on Leeds Vaccination Programme. Second, a late item entitled West Yorkshire Devolution, consent to non-transport borrowing powers. And third, supplementary information in respect of item 10, which is the COVID-19 pandemic response and recovery plan report.
Thank you. I will ask board members if there's any declaration of interests. I see there are none. Item 5 is to agree the minutes of the Executive Board of the 17th of November. And I'm going to take that everybody is happy. So we move on to our first paper, and Councillor Cooper, please, item 6.
Thank you, Leader. First of my papers today is the Financial Health Monitoring Month 7. The position for us this month is just short of £1 million overspend. Given the year that we've had so far, I think actually that's a remarkable position for us to be in, and especially with the uncertain situation surrounding COVID that we've been in throughout that time as well, and still find ourselves in and responding to. Although that I would say that we are expected to bring in a balanced budget by the end of the year, but that is provided that we can still continue to deliver the rest of the £56.1 million of savings that is within that year's budget. I would also say that the month 7 report just reflects a position around the national employer's final offer to staff as well. And I'll leave it there, Chair.
To item 7, please.
Thank you, Chair. Item 7 is the second report for the Executive Board around the revenue savings proposals for next financial year. First report came in September, and that proposed around £20.6 million worth of savings over the next 3 years. The report today adds a further £11.1 million of savings over the next 3 years, which brings a total of £31.7 million worth of proposals being brought to Executive Board. They are in the main business as usual proposals, with the exception of 2 service reviews. Thanks, Chair. I'll leave it there.
Thank you, Councillor Cooper. Are there any questions or comments? Councillor Lamb, please.
Yep, thank you, Chair. Just one comment. As you'd expect, we'll save most of our comments on the savings and the budgets for another day in another place. But I think you'd be disappointed Councillor Lewis if we didn't make the point that if it wasn't for decisions around MRP and council borrowing, potentially there wouldn't have been a need for any budget reductions at all this year.
Bit like a children's cartoon when everybody knows what everybody knows what's going to happen in the end. And I would make the point that we would have had to make reductions in previous years, and no political group on the council came up to an alternative with that. But I'm sure we will rehearse these arguments again and again when we get the captain hindsight routine, as we often do over this matter. Councillor Galton, please.
Thanks, Chair. Opposition leaders do appreciate the preparedness of the council's budgeting process and allowing us to be involved in it. But when it comes to papers such as this, emphasising which parts of the council will be expecting to have contingencies made or new cuts introduced, it is good to have a consistency about the reporting. And unfortunately, it doesn't feel like there is a consistent approach to delivering briefings on whether it be business as usual savings or even transformation savings between the different departments. I know that in this paper and in previous papers in September, adult social care have a tendency to outshine other areas in terms of how they explain what they intend to do, why and how, and what the consequences are. And it feels that the proposals which come from other departments oftentimes are light touch. And I wondered if the leader and Councillor Cooper are doing anything about trying to, what's the word, level up the response from the different departments in terms of what they take into consideration when they're making cuts.
Yes, please, Councillor Cooper.
Yeah, thank you, Leader, and thanks for your comments. And I have to say that, you know, through the leadership of Neil Evans and Victoria Bradshaw, the discussions around savings, I think, has been exceptional this year, given the fact that we're in December and we're at such a level to be able to bring this to you now. And we're already in September bringing about those proposals and the thoughts around that. Then I think that every directorate has played its part within that. If you think that that maybe one or two of them have not perhaps given that kind of level of briefing to you, I'm happy to arrange for you to have that, Councillor Golden.
Chair, just to clarify, it wasn't having a briefing from an officer, it's putting something in writing to show that all of the consequences and mitigations for each of the savings has been taken into consideration. We do have an exemplar in the council, and I just think it's useful for that to be promoted amongst other parts of the council.
Chair, if I may, I think this paper, if you read it throughout its detail, will show you, you know, all of that you've just asked about. Yes, I think it does, Councillor Galton, and so did the September paper.
Thank you, Councillor Cooper. Are there any more comments on this item? I will turn then to the recommendations on page 65 over onto page 66. And I take it everybody is happy with those recommendations, which brings me on to the items under my portfolio. The first one continues on from the last item, which is the proposed budget for the financial year 22-23 and the start of planning provisional budgets for the two subsequent years. As Councillor Lamb has pointed out, customarily we deal with these items at the Budget Council meeting in February, and I'm happy if there's any questions and comments at this point. Okay, Councillor Golden.
Just the customary reserving of positions, Chair.
Thank you. Turn to the recommendations on page 84 about taking the budget out for consultation, and noting Councillor Galton's position. I see the rest of the board are happy, and we'll now move on.
So if you could formally note our group's position as well. Had I have had a vote, I would have reserved.
Had you had a vote, you wouldn't have used it. Yes. We will.
And I'd like you to record.
Yes. 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 Don't worry. Don't worry, Councillor Lamb. I have noted that even though you smiled, I didn't take that as acceptance of the paper, and you can report that back upstairs. So on to item 9, which is the initial proposals for the Best City Ambition. Again, this follows similar to the last item, is one that we are asking Executive Board to agree to go to consultation on our approach to a Best City Ambition. It's been to Executive Board before. We're asking for it to go to scrutiny and wider consultation. This is our intention to build on a lot of the much closer partnership working that's been developed over nearly 2 years during the pandemic, to look about how we can work with partners and everybody in the city on moving forward with what our ambitions are overall, and identifying a number of target areas to particularly accelerate. We expect this is a paper that goes out for consultation. It's the first time we've taken this approach. I think it is one that is really positive for us, and I'm expecting a good response to the consultation, both in terms of some of the areas covered, and again how we can continue to work together. Are there any questions or comments on this item? Councillor Lamb and then Councillor Golden, please.
Yeah, thank you, Chair. So I think, to be fair, actually, it feels like a step in the right direction in terms of engaging with people, in terms of taking it out to the wider community. And I think previously, probably our criticism would be it was a top-down ambition. So it feels a step in the right direction. The assurance we'll be looking for is that we are genuinely going to take on board what people say in the city, and that this is the people's priorities, if you like, that are going to be put forward, and will shape the ambition. But so far it looks good, but I hope it will follow through.
Thank you, Councillor.
Well, I think that's a reflection of what this paper is. It could be all things to all men and women, because it's very short on detail and direction. And I appreciate this paper says it's all about having that conversation with the city. But the administration is in charge, and people who are in charge of large organisations are expected to provide leadership and drive policy. And other than mentioning the 2030 climate change targets that the council has set itself for, most of what is in this paper is pretty abstract in terms of what the city aims to achieve. And the language has been changed from the best city plan to the what is it called now? The big ambition, or the city ambition plan? The best city ambition now. Well, when you have an ambition, it generally is something that you're able to articulate, and it tends to have, you know, a timescale associated with it. And I'm not sure this actually says what this administration hopes to achieve within the next 5 or within the next 10 years. And I hope that as this process goes forward, because as you've said, you want it to be open, that the administration does say what it thinks its priorities are in terms of making the difference in this city.
Thank you. And I think draw the conclusion from Councillor Lamb not wanting us to be top down, and Councillor Galton as wanting us to be more top down. That at this point, and I do stress this is going to consultation around developing the work, and I think one of the opportunities but challenges is working with partners. It's understanding what other people's appetite is to work towards a common ambition. I think we're in the right place to start a consultation, and I look forward to hearing. I look forward to hearing further views from everybody in the city on this. With that, I'm going to turn to the recommendations on page 149, and I take it everybody is happy with those. Great, thank you. It's the next item on under my portfolio, which is the update on the coronavirus pandemic response and recovery plan. And I don't need to remind anybody, this has moved on extremely quickly in the last week, and we're certainly committed, as we have been for the last 2 years, to work with the government, with public sector, and other public sector organisations in the city and the whole community to try and move us on from the scourge of the virus. I don't say any more just without reflecting on the fact that we now know that 1,901 people have been recorded as dying in COVID-related circumstances, and clearly in Leeds, and clearly every one of those is an individual tragedy for families, friends, and loved ones involved in that. And I think that sort of underlines why it's so important we continue to work to encourage vaccinations and to reduce the impact of the virus and of the pandemic on people. There's been changes in the government restrictions which are set out in there, and given the Prime Minister's announcement over the weekend, I've asked for a separate paper on the vaccination programme to come forward about how we can, as a council and as a city, support the government and the NHS's work to deliver vaccinations. There's 2 items in a supplementary paper. I think it's I'm going to take them as I'm just going to take them as one discussion, and then we'll turn to the recommendations. So in terms of my introduction, that's what I wanted to say, and I'll ask Councillor Arif to comment on the vaccination programme, please, then invite comments from the board.
Thank you, Chair. So as we've seen throughout the pandemic, there's been a fantastic Team Leeds approach. The report provides an update on the excellent partnership work taking place across Leeds between the NHS, a wide range of council services, third sector and community organisations, to scale up the COVID-19 booster programme while still continuing to focus on areas where we have got lower vaccine uptake and those people that are most vulnerable. We recently did pass the 1 year milestone since the first Leeds vaccination programme began. Over 1.3 million vaccine doses have been administered in centres across the city. As the report highlights, those involved have had to operate with a high level of flexibility, responding to changing needs, fluctuating government guidance and differing approaches from ministers, as well as adapting to the emergent evidence base about COVID-19 and the vaccines themselves. In total, 75% of the eligible population have been vaccinated, with 50% of those subsequently receiving the booster dose. It's really important we continue our work to increase the uptake, and I know the NHS figures from last week, from the week of the 5th of December, showed more than 60,000 adults nationally only received their first dose that week. We will continue to work to increase accessibility and vaccine confidence to ensure that no one is left behind. I'd like to take this opportunity to thank everybody who's been involved in their efforts and working at pace to adjust the programme to offer the booster vaccine to everyone eligible a month earlier, particularly during an already difficult winter for the health and care sector. Thank you.
Thank you, Councillor Arif. Councillor Lamb and Councillor Golden would like to come. Councillor Lamb, please.
Yeah, thank you. I think I'd echo Councillor Arif's thanks to all the people who've been involved in well, it's an astonishing achievement, really, to think a year ago the first jab went in somebody's arm, and here we are now trying to get the boosters into people. So I think we can only really applaud the efforts of all those people and everyone across the council and the partners for what people have tried to do to keep people safe and keep things moving forward. And the question really is it is not in any way criticism, what collectively can we do to try in the areas of the city where the take-up isn't what it needs to be, what more collectively can we do to try and give that a push and try and get more jabs and deal with some of the silly misinformation that people are putting out and giving hesitancy. So that's really what can we do?
Councillor Arif, if you'd like to come back on that, please.
Yeah, it's a really important question, and I know this more so than my ward because we have got lower uptakes. I think we'll just keep at it, and I think as a council, you know, with the No One Left Behind, that's still very much on our agenda, to go back to those communities, look at what the barriers are. Just one example that I'd like to give you, in my ward last week, we sort of did it slightly differently. What we did was we did a winter wellbeing event at a local school, and through that we got parents in and we managed to get 33 vaccinations. Now I'm fairly confident we perhaps wouldn't have got those people. So it's being different and looking at what works in different communities, but also as leaders, as leaders ourselves, leaders in the community, just we mustn't stop with the message of how important it is that we continue to get the jab and the importance of it protecting not ourselves, but our family, our friends. So it's just keeping up with that message, really, Councillor Lamb. Thank you.
Thank you. Councillor Golden, would you like to come in?
Thanks, Chair. 2 points, really. The first one is we've had the headlines about the difficulty that we're having in the social care sector about enabling people who are currently in hospital to find care places for themselves in the community because of the shortages in the care workforce at the moment. But we're also aware that the health service is trying to prepare and anticipate a rise in hospital admissions through the further spread of Omicron. And it'd be really useful to understand what ratio of beds is that the delayed discharge actually represents in terms of not helping with that preparedness. And then the second is around the vaccination issue. It's great that we're having pop-up centres in those areas where there is the highest non-vaccinated, but there are also issues for communities which are not on the best public transport system in terms of being able to get access to vaccines. And I recall that when I tried to get a booster, the nearest one that I had, it sent me to Castleford from my side of Leeds, and that was over 3.5 miles away. I understand that there's discussions to be had with local pharmacies to see whether they can help in deliver the capacity. And I'm just wondering, is this something which is channeled through the CCGs, or is this something that pharmacies themselves can put themselves forward to offer that kind of community vaccine support?
Thank you, Councillor Golden. I don't want to sound like an anorak, but you can get the 140 and 141 bus from Oulton to Castleford, and it runs every 15 minutes. I don't know if anybody wants to come back on Councillor Golden's 2 questions. Victoria, please.
Thank you, Leader. Thanks, Councillor Galton. I can take the second one of those. I think Kath's better placed to take the first one. So one of the things that we've been keen to do all along, but are particularly keen to do now, is to ensure that in the plan for booster provision, we've got as many local and accessible sites as possible. You're quite right, Councillor Galton. We initially had very strong involvement from all GP practices across the city through the primary care networks, which fell away to some extent in the middle part of this programme. Over the last week, we're really pleased to hear that all GP practices have now re-engaged with the booster programme. And that's just happened over the last few days with the recent announcement and the new offer that they've been given as GPs to participate. So we will now see local offers through GP practices that weren't there a week or two ago. So that's obviously led mainly by NHS colleagues, where we come in is all of the work, including what Councillor Arif just described around more community venues that are outside the NHS but still most accessible for people. So so the GP practice situation has improved significantly over the last few days. And I think one of the big challenges is, as that is moving very fast, making sure that the information on exactly where people can go is all in one place and easily accessible, and there's clear messages around that. That will be through the NHS Leeds website. So we're working hard to make sure that's live and up to date. On the pharmacy question, undoubtedly, there is a conversation about how we up the number of pharmacies that are currently involved. There's currently 12 community pharmacies involved, and we have an ambition to increase that fairly significantly. Sam Prince is leading that work as the NHS lead for vaccines, because it is dependent on a contract with pharmacies, in the same way that the GPs have had a contract around how much they get paid and what they can drop. But we'll obviously be advising Sam around access for communities and which pharmacies would, fill the gaps that we need to be filled from a community point of view. So yeah, thanks for your comments, and we'll continue to take that work forward.
Thank you, Victoria. Kath, I can see you indicating, please.
Yes, on the issue of proportionality of delayed discharges, today there were 224 delayed discharges, and that's on a bed base of roughly 1,500. So it's just short of 15%. And the figure tends to bob up and down between 200 and 250, depending on the day of the week. But it's quite a lot.
Thank you. Tom, would you like to come in, please?
Yeah, I was just going to say, for the oversight role of exec board, really just for the sort of record, the gold, silver, bronze arrangement of operational whole system working has been in place throughout the pandemic, actually, and we haven't stepped it down completely, but we've increased the frequency of those meetings now, and I chair the gold meeting with the system partners like the chief exec of the the hospital and the CCG, etc. And that team leads approach is absolutely hardwired into the way that we're working, as you've heard. I just mentioned three specific issues. One is around, there is a financial impact for the council already of working from home, given the income elements of our budget that we have. So it's important to flag that up. We're in dialogue with the government as a sector about that, and previously the government has stepped forward to help. So that's something that everybody will be keeping a watching eye on. And obviously there's a direct impact on certain sectors, and again, the government is actively looking at that, and we had a role in helping those sectors for the government in terms of grant giving and etc. And that may kick in the new year, it may not, depending on how long this lasts. The other thing that I think we're all planning for in January, February is potential impacts on levels of workforce provision, where if more and more people are having to self-isolate, then we had a system last year where we did manage to move people around the council so that we kept services going, and that's happening again. Neil chairs the Silver Group that's dealing with all that, and we've got contingency plans in place. And then the final point was just a very practical one. We're meeting today, socially distanced, safely, face to face. It's harder to do that as full council, and the government did allow councillors to meet virtually when the pandemic hit its height previously during lockdown, and the sector as a whole is in dialogue with the government about whether we need to do that, given budget councils are coming up, and there may be a challenge to make that happen. So we'll keep you in touch with that, and obviously that's a very practical issue for us, because if budget council is the decision-making body of setting the budget and allowing all the services to run throughout the year. So it's important, I think, just to note that.
Thank you, Tom. I don't see anybody else wanted to speak on this. So there's two sets of recommendations to agree. The first one is on item 10, which is on page 181 of the main documents. That's the update, and I take it everybody is happy with those recommendations. And then the second recommendations are on page 4 of the supplementary pack. That was the late item on the Leeds vaccination programme. And again, I'd like to as we move these recommendations, thank officers for the work on this and for producing this report so quickly for today's meeting. And I take it everybody is happy with those recommendations. Great. So we're moving on to the second late report in the pack, which is the West Yorkshire Devolution consent to non-transport borrowing powers. This is a continuation of the development of the devolution deal, which we started in March 2020 national budget. We concluded the statutory processes in January 2021. The first Mayor of West Yorkshire was elected in May 2021, and this develops working closely with the other councils, Mayor Brabe in the Combined Authority and the government, the powers for the Combined Authority to borrow for the non-transport funds. It's always had powers to borrow to deliver transport, but this covers the rest of the remit of the Mayor. Are there any questions or comments from members? Councillor Lamb and then Councillor Golden.
Yeah, thank you. I think the main comment is, for us, the concern that it doesn't seem to involve opposition members across the authority in the decision making. And I think really what we're looking for is an assurance that, while it doesn't say they will in the papers, that will happen. There'll be a timely consultation and engagement with opposition members so that we can properly understand what's being proposed and make contributions to that.
More than happy to put any briefings in place and any involvement in place that is needed, needed around that. Of course, Alan. Councillor Galton, please.
Well, Liberal Democrats believe that devolution should mean devolution, and that usually should involve some kind of fiscal powers. In the absence of that, having some flexibility around what you're able to borrow after you've basically articulated to the people that you're representing what benefit you hope to achieve from it is something which I think is particularly useful. And given that the Combined Authority has powers over adult training and skills in particular, at this point in time where we're seeing those tensions in logistics, in the care market, and we're looking to develop a greener economy going forward, being able to pull out the stops in terms of delivering the right skills training needed as soon as possible is something that we should be giving to the Mayor in terms of being able to have those powers. So I look forward to plans being brought forward to how these powers might actually be implemented.
Thank you, Councillor Galton. I do as well, but the first thing we need is the power. So I welcome the support for this, and I should, I don't see any other comments from the board, so I should note before I turn to the recommendations that given the late nature of the paper, Councillor Andrew Scopes has been consulted as a relevant scrutiny board chair as well on this. So with no further comment, I'm going to turn to the recommendations which are on page 9 of the late items pack, and I take it everybody is happy with those recommendations. Thank you. That's the end of the papers under my portfolio, and we now move on to Councillor Venner's portfolio, please, and item 11.
Thank you, Chair. This paper proposes 2 changes to social care charging. One change is to remove the maximum assessed charge cap, which I'll refer to from this point forward as the MAC cap. Removing the MAC cap means that the amount people pay for social care will no longer be capped at £482 a week. The other change is that people will be charged for 2 carers if they require them, which is not the case at the moment. If the council provides care directly, we only charge for 1 carer. Increasing social care charges is not a decision taken lightly. It's in the context of the council having lost £2 billion in the past 10 years. And within this, adults and children's social care has been very protected and now represents 63% of the council's budget. This is also in the context that, unlike the NHS, social care is not free at the point of use. Adult social care is provided on the premise that you pay for social care, and the state only steps in if people cannot afford this. An important point to stress early on in my comments is that nobody will be asked to pay more than they can afford to. The proposal to remove the MAC cap and charge for 2 carers if required affects 266 people across the city. 208 are affected by 2-for-1 carers and 58 affected by the MAC cap proposal only. A further 47 might be affected because they are receiving 2 carers and have yet not been financially assessed. This proposal is basically removing subsidies. Currently, people on lower incomes are paying the maximum they can afford for social care, while people on higher incomes are having their contributions capped. It is also a current anomaly that if someone has direct payments and employs their own carers, they pay for the number they need. But where we provide care directly, we only charge for 1 carer, even if 2 are required. This proposal would generate an estimated 2 million as a minimum. We expect to generate more, but we don't know how much, as people have not been financially assessed who are currently at the MAC cap. This is why we have said up to 4 million, but we are confident of achieving 2 million as a minimum. We are proposing a phased approach, 25% after 3 months, 25% after another 3 months, and the full amount after 9 months. And this was introduced as a direct result of the consultation. Nobody will be asked to pay more than they can afford based on national legislation and guidance. As this affects a relatively small number of people, we can monitor each case. Kath also has discretion as the Director of Adult Social Care to waive charges in individual cases if this will cause hardship. Benchmarking demonstrates that few comparable local authorities have a MAC cap and most do charge for the actual number of carers. Liverpool are the only core city that doesn't, but they are also reviewing this. Campaigners across the country have argued that increases in social care inevitably impact on the most disabled people. As I said at the beginning, social care is not free at the point of use, and this does mean that the more care you need, the more you pay for. However, nobody will be asked to pay more than they can afford, and this proposal is removing subsidies. As I referred to earlier, at the moment, people on low incomes are paying the maximum that they can afford, while people on higher incomes are receiving a subsidy. And it is not fair that people on direct payments are paying more for care if they have 2 carers than if we were directly providing the care. If we do not save this income from this proposal, we will have to take it from preventative services, discretionary services that support people in the community. The £86,000 cap on lifetime costs will mitigate the impact of the removal of the MAC cap for some people, and we don't include the asset of someone's house in calculating care costs. This also does not impact on people who are entitled to funding either under continuing healthcare or under Section 117 of the Mental Health Act. In summary, this proposal is to remove current subsidies where some people are currently getting for social care. It removes the MAC cap, so removes the subsidy currently provided for people on higher incomes but not lower incomes, and charging people for 2 carers resolves a current anomaly that disincentivises people from having direct payments and paying for their own carers. Thank you, Chair.
Thank you, Councillor Venner. A very comprehensive introduction. Are there any comments on this paper, please? Councillor Lamb, please.
Yeah, thank you. There's a few concerns. It is a very, very comprehensive and detailed paper, and I thank Councillor Venner for the comprehensive introduction. But I've got a few queries, if I may. So first of all, can we have a firm commitment that the money raised will be going back into services, and it's not just going into general council consumption? Secondly, can you give us some more detail about how many people specifically are going to have to pay more in this? Because it says the majority, I think it's about 5% or so, are expected to have to pay more. Is there a number to go with that? Because if we're expecting £4 million to be raised from a very small proportion of people, that could mean a number of people paying a substantial amount more money. How much is this predicated on people behaving exactly as you expect, that they will just effectively say, right, we'll pay? So the highest scenario in the examples provided is someone paying an extra £650 a week. I find it difficult to believe that whatever your level of income, anybody is going to just hand over £650 and not bat an eyelid about it. So one of the worries is, do they change their behaviour? Do they change their arrangements? Does that have a knock-on? Do families start making different decisions about their care? And what effect does that have down the line? So how robust is the figure, and how much is it predicated on people just saying, yeah, another £650 a week, no problem, there you go. I find that hard to believe. And equally, is there a danger that this has a knock-on impact to the health service and to the council budget elsewhere if more people decide they can't afford to provide care at home and start looking for residential, where the council may start to incur costs as a result? So there's quite a few things. I appreciate it's a difficult thing to do, but it's just seeking some reassurance that we have thought of these things and that there are plans in place for them.
Thank you, Councillor Lamb. Councillor Venn, would you like to make a start on those questions? And of course, if there's detailed information, we may need to provide a written response.
Yeah, I would add, Chair, John Crowther's here as well, who's generated a lot of the data, so maybe I'll add more detail. As I said in my introductory comments, this is about a saving that we need to make from adult social care that if we don't make here, we will have to make somewhere else. And because so little that we do now isn't statutory, it would come out of those community-based preventative services. So this isn't about generating income that we can then spend in other ways. It's about not having to make a cut somewhere else. In terms of the number of people, I did give the figures, which is it affects 266 people. I would say that a huge amount of work's gone into this paper, and Cass and John's team have done a massive amount of work on these numbers. So we are fairly confident they're accurate. The combined number is 266 with 208 who are affected by both the 2-for-1 and MAC cap, and 58 that are only affected by the MAC cap. But you are right, Councillor Lamb, that that does mean some people will be asked to pay considerably more who are currently having their contribution cap. That is a reality. I would add, though, again, it is removing a subsidy, because at the moment people on lower incomes are already paying the maximum they can afford, and people on higher incomes are not. In terms of the changes to people's behaviour, this is where the reviewing social workers are really important. And also the fact that this is a relatively small number of people means that we can work quite intensively with each person and each family and provide support and make sure that we are not either causing undue hardship, in which case Kath does have some discretion, or having any unintended consequences as a result of this. I know one of the concerns in consultation was, well, will people choose to have less care? But actually, with the 2-for-1 care, I mean, that's usually around hoisting and moving people, and it would not be in someone's care package that they would suddenly have a reduction in care, because it just wouldn't be possible. But each situation will be monitored, and we can do that because it's a small number of people. And in the case of your question about residential, I mean, we would always support people to live in the community, and the cost of residential care is such that it is still likely to be cheaper for almost everyone to remain in the community rather than going to residential care. I don't know if Kath or John want to add anything to my comments, but those are my responses to the questions.
think you've covered them comprehensively, Councillor Venner. The only thing I would add is that if people move into care home care, then their property is taken into consideration for their charge, which again is often a very strong incentive for individuals to remain living in their own home.
Thank you, Kath. Councillor Lamb.
Yeah, there's one further point just on the low response to the consultation with less than 2% of people responding. That concerns me that I've got a letter from, I won't read it out, from somebody who, and I believe this is quite common, people find it very complicated to engage with and understand. And when so few people have responded to something that could be a very, very significant change for them, it's a concern that how well has it been communicated and understood by people who will be affected and their families. So that's a further concern. But I think, I know the point you made. I think it's something we need to keep a very close eye on. And I'd just ask that I note Kath has discretionary powers, but that there is a preparedness to keep this under close review and make adjustments as things go along if it's deemed to be necessary. So we don't get sort of wedded to it come what may. If it's having a really negative impact on people, that we're ready to adapt and change.
Thank you, Councillor Lamb. I think I can see Kath and Councillor Venner want to come in, and clearly, Councillor Venner did say, obviously the small number of people involved means that a lot of time can be put into supporting people individually through this. Kath, please, and then Councillor Venner.
So paragraphs 91 onwards describe in detail how we set about the consultation, and it was only right and proper that we emailed or communicated with everybody who's in receipt of care in a non-residential setting. So that's 5,196. We received 103 responses, but if you put that alongside, actually it's 266 were directly affected. It's just short of a 50% response. So people who aren't financially affected are less motivated to respond. So my assumption is the 103 who did respond, who felt at risk of a change of their charges, have let us know what they want, what they thought about it. So if you look at the 103 responses alongside the 266, it's better.
Thank you, Kath.
That's the point I was going to make, that we sent it out to everyone in receipt of care, not just people directly affected.
Thank you. Councillor Golden, would you like to come in, please?
Yeah, I just wanted to recognise the difficulty that there is here, because it's pointed out in the paper that this affects just 4.5% of people receiving care in the city, but it also indicates that they're probably at the higher end of need as well, because of the two-handed support that a lot of them require. I was just going through all of the survey responses as well, and there is a significant level of concern, but I don't think any of this has been done lightly, and the detail which is in the report points to the fact that the service is well aware of any amelioration or mitigation that might be needed in individual cases. And I think that this is the key to this, is making sure that it's a personalised response. And the graded introduction, I think, does offer some of that reviewing capacity as time goes by. And I think it would be really helpful for members of the executive board for an interim report to be sent to us, maybe after 6 months or so, to let us know how the service is getting on with introducing this and understanding what some of the impact has been and how we're responding to it. Not so much in terms of a formal executive paper, but definitely in terms of a briefing note. That would be really helpful, because I know that you don't make this decision lightly as professionals, but as executive board members and lay people, that would give us an added level of assurance as well that this is the right road to be going down.
Thank you, Councillor Galton. Councillor Venner would like to come in, please.
We'd absolutely be happy to do that. I mean, I would add the phased, I think I said this in my introductory comments, the phased approach was added in as a direct response to the consultation. We can obviously do a briefing note after 6 months. After a year may give you a more accurate picture because of the phased approach. So people who've got to pay more won't be paying the full amount for 9 months. So we could perhaps do a note at 6 months and 12 months. But thank you.
Thank you, Councillor Venner. I don't see any more comments, so I'm going to move to the recommendations on page 206. And I take it everybody is happy with those recommendations. Thank you. And we'll move on to Councillor Rafiq's papers, please, and item 12.
Thank you, Leader. This is a report provides an update on the waste management service operational response to the challenges being faced by the service during the ongoing pandemic and the related financial implications as requested by the Executive Board in October. Can I just, before I go into the three different appendices, can I just say that we are the largest, second largest provider of refuge service anywhere in the UK, and the largest provider of free garden waste service in the UK as well. We've actually emptied over 39 million bins during the pandemic, containing over 400,000 tonnes of household waste. This is 37,000 tonnes more waste than usual and equivalent to crews emptying an extra 3 million bins as more people continue to work and learn from home. During the pandemic, we also emptied over 2,500 tonnes of garden waste as well. And can I also say that our actual performance based on the government's formula is during the pandemic is 99.85%. And before the pandemic, that was 99.93%. No, this is all, the monumental effort, I think, put in by the staff over the last 20 months, despite many challenges, apart from the adverse weather conditions, staff having to isolate, staff recovering from the virus, driver shortages, labour market shortages, difficulties in terms of recruiting, agency staff, coupled with obviously, in more recent months, August, September, where staff having to, struggling to do overtime because people, wanted a, bit of time for their families as well, like everybody else, where after a 20 or 18 months of lockdown, and I think back in the middle of August, there was some obviously relaxation of restrictions. So that has had a little bit impact on the service as well. And then as more people work from home, there's actually more cars as well, apart from obviously the rubbish generated as well. And the second bit is actually looks at the actual costs, which I think has sometimes been referred to as overspent. Well, it's actually not overspent. Is actually the cost of collecting the extra waste from our residents as a result of the pandemic, as more people work and learn from home. So that's actually broken down into three areas. An estimated 2.23 million is the cost of contractual disposal and processing of the additional household waste, which is continuing to be presented as more people are working from home. An extra 1 million is spent on the hire of extra refuse collection vehicles by fleet services to ensure sufficient extra sports and backups sent out each day to manage the extra waste and replace the RCVs requiring deep cleans following the crew COVID cases. An estimated extra staffing cost of 1.89 million to deploy enough cover for staff self-isolating to collect the extra 20,000 tonnes of waste anticipated to be presented at the curbside this year, to maintain the successful management of COVID-19 in the workplace and crew cabs and transport staff to take leave accumulated since March 2020. This is through a mixture of extra contracted staff, agency staff, and overtime as well. So all that kind of results in 6 extra crews having to be deployed over 6 days a week. The final appendix provides information on the work being done to ensure that the service remains resilient to further pressures and to tackle some of the improvement priorities areas that were identified before the pandemic, e.g. the route review and moving to the new depot, which will happen in the new year. Before I actually stop, Chair, I'd just like to put on record and thank the teams for the huge effort they put in during the last 18 to 20 months, and certainly from the start of the pandemic. I think despite the challenges, we still remain one of the best refuse collection services in the country. But let's hope, going into the new year, as things improve, although we're not, we keep saying that we're kind of out of the woods, but with the pandemic, we don't know where it's going. But we are, as we go forward for going to next year's budget, we are obviously projecting the extra costs into next year's budget. Thank you.
Thank you, Councillor Rafiq. Are there any questions or comments on that paper? I see Councillor Golden and Councillor Lamb look very excited, so I'll take Councillor Golden first.
Thanks, Chair. I'm afraid Councillor Rafiq is slightly delusional if he thinks that the performance during COVID was exemplary. The individual efforts of Bing crews and the operatives within that service were so. They did an excellent job given the conditions that they were given, either environmentally or societally, or by their management. And I think this is part of the problem in terms of how you measure your success, Councillor Rafiq, because you keep going about how we're the biggest authority on this and we're the largest authority that offers free brown bin collection. Well, as was mentioned earlier, we're also supposed to be the best city, and therefore we should be offering the best quality, not just the best quantity of service. And the experience which has been had over recent months by your customers who pay the wages of the waste service has not been the best. And unfortunately, a lot of them, you talk about the percentage success rate and how, according to government figures, you were 99.97% efficient or something. And I would point out that that efficiency measure measures collection on a given day or within 48 hours afterwards. So that amazing success rate could also hide a very high initial failure rate. And unfortunately, the recovery option is quite expensive to do. If you're not doing it well the first time round, it actually costs you more to go back and sweep up again. And we really were expecting to see something a little bit more, what's the word? Humble in terms of thinking about how things could be done differently, having had the experience of COVID and a service under pressure. And I would have liked to have seen a service review of the waste collection service included within the budget terms, so that you weren't relying on a £5.1 million ring-fenced overspend contingency subsidy. And I think that's what we deserve to have in this paper. And unfortunately, it's a little bit too defensive for its own good.
Not sure about the word subsidy, just to reiterate that we do provide brown, green and black bin services at no extra cost of service. So I'm not quite sure about the use of the word subsidy, as it's all free to people in these. Well, I think the extra cost, Councillor Golden, is putting crews and wagons out there and the disposal cost. It's emptying people's bins. I think it's what the taxpayer would expect us to do. Councillor Arif, would you like to come back, please?
Yeah, I mean, I think I've already, the report is self-explanatory, Councillor Galton. You know, it says when you talk about 5 million, it actually, the cost of disposal of extra waste, that's not something we take. This is the extra waste. It's there, you know, it's in plain English, in black and white, that the extra tonnage we have to collect. It's there for whether it's, you know, obviously 2.2 million is the disposal, 1 million is for extra refuse vehicles, and then the 1.89 million is the related kind of staffing costs. It's not rocket science, you know. I can't be any more. The report can't be any more clearer than that, Councillor Galton. So I'm not really sure what exactly, you know, where you want to go with this. As far as the performance is concerned, I think. If you compare with, you know, many other public services outside the council, I think, and indeed, like for like, the refuse services across the country, where they've experienced many issues, much more issues than we have. And we do talk to and get the info from all other our competitive partners, core cities, and we know that, you know, despite the challenges, and despite time, I mean, what you're doing is, you know, on one hand you say that, well, the crew out, you know, on the doorstep, they do well, but then you actually indirectly, you know, criticizing the crew by saying, well, X, Y. Well, that's exactly what is being done, you know. So, I mean, I don't want to go into, you know, what was said previously, but you know, through council, but the thing is, you know, you've got to, I think, put your hands together for the service provided. We've got, obviously, you know, all the data for all the missed bins. The 48-hour it isn't included in the 99, but anything outside that is 1%. If you collect 85,000 bins a day, you know, 1% equates to, Councillor Galton, that's 850 bins. 850. 0.5% is 450 bins. You know, if you look at some of the logistical challenges, apart from obviously the pandemic, in terms of the vehicles on streets, in terms of roadworks, you're always going to have some sort of you know, misses because of those challenges you face, you know, even if you didn't have a pandemic. But obviously with a pandemic, you are having to, I mean, the other thing you've got to bear in mind is that over the last 4 months, if you look at the actual pandemic, you know, virus numbers, you know, they were much higher than the start of the year, even though people aren't obviously isolating because you've been double jabbed, but obviously the virus is still out there, you know, 50,000 new cases a day. This is people who are being on, you know, getting a PCR test. So, you know, it's a report, I think, encapsulates, you know, the three different sort of areas. And I think as far as the actual review is concerned, well, that's something we are working on. We can't do it, you know, until we actually come out of it. But we you know, we couldn't have done it in the last 18 months, but that's something is planned for the new year, and it's in the report if you've read it.
Thank you. James Rogers would like to come in, please.
Yeah, thank you, Chair. I will be brief because Councillor Rafiq has covered all of the points that I would have made, but I'll just really emphasise, just for me, 3 or 4 key points. So 85,000 bins a day is a massive operational logistical challenge that we've got every day to go out there and collect bins. And we're seeing currently 10% waste, excess waste, and that has been up to 20% during the course of the pandemic. The routes weren't designed for that level of waste, so we've had to adapt our response to that on a daily basis to make sure that we can do and reach the performance levels that we've reached. In referencing other local authorities, I think it's interesting to point out that during the summer, a large number of local authorities actually stopped their garden waste collection service in its entirety because they were having the same challenges as us and couldn't cope with that. We managed to collect 95% of our garden waste throughout the whole of the summer period, which I think is a real positive that we should be proud of. And when Councillor Galton references that there's nothing in there about a service review, well, that's what the route review is. The route review is looking at the future collection arrangements for the service within the context of the resources and the money we've got available to us looking forward. Thank you, Chair.
Thank you, James. Councillor Lamb, please.
Yeah, thank you, Chair. I'm listening to this with increasing incredulity, I have to say. If you were coming from out of the country to listen to this and read the report and hear from Councillor Rafiq, you would think everything was wonderful. There's no problems in the service. Everything is fine. Everyone's bins get collected on time. We now hear the astonishing claim that an overspend of £5.3 million isn't really an overspend at all anymore. I think that was the words that were used. And I'll caveat my criticisms with being absolutely crystal clear. They're aimed solely at Councillor Rafiq, nobody else, just you. Just so, and I think Councillor Golden was making exactly the same point. So I don't think anyone here was criticising staff. The criticism is for you, and it's fully deserved. What I would challenge you, Councillor Rafiq, is to come to my ward, or Pudsey, or Armley, or somewhere like that, and repeat what you've just said about how wonderful the service is to my residents who repeatedly don't have their bins collected on time, same streets, time after time after time. Several months ago, I sat with you and your officers, made some suggestions for how we could try and address that in the short term. Really simple things, because one of the issues was the bins were regularly full halfway along the route. So we suggested, why not reverse it every other time? So at least it's not the same people. That quite simple. Could we do that? No, we couldn't. A number of other suggestions we made, engaging private providers who in theory are processing less waste because more people are producing it at home, which means they're not producing it in a business. There are commercial waste providers in our ward that could probably help. No feedback as to whether that's happened or not. Councillor Golden just pointed out to me that when you said about staff absences, there was a point last year that 83 staff off on the same day. 3 of them had COVID. The majority have been given holiday at the same time. That's bad management. That's nothing to do with COVID. I think, picking up on Councillor Lewis's comment, the majority of people, taxpayers in Leeds, expect as a very bare minimum that their bins get emptied on time. They don't mean within 48 hours, they mean on time. And if it's missed, that it then gets picked up. And I think there's a huge disconnect between the rosy view of your report and your comments and what the people of Leeds are actually experiencing on a day-to-day basis. And I hope you will accept the challenge to come to my ward and join me and my colleagues and go and visit our residents and hear what they have to say, and do the same in Pudsey and do the same in Armley and other parts of the city, because they'll tell you a very different story to this report.
Thank you. Councillor Rafiq would like to come in, please.
Yeah, I mean, you did raise something with me back in August, I think. We did have a meeting, and as far as I know, and I'll let John to come in on this, we're not aware of any further challenges. I do know that since August till the 14th of December, we've had 6 inquiries from your ward this year. The year before, we had 13 inquiries during the same period. The year before, we had 28 inquiries during the same period. So for you to suggest that is actually the service, and we can go back another 5 years, you know, or beyond, say that. I think it's actually hitting below the belt. And you are, you know, whether you say it or not, you can say 100 things to me, I'm fine. I've got thick skin, Councillor Lamb and Councillor Galton. But the reality of the matter is you are having a go at the very staff who actually go out in a very difficult circumstances, in adverse weather conditions, will go out and empty out bins and have done an excellent service. I'd say an excellent service for the residents of this city. And can I just say, when we had the snow a couple of weeks ago, some of the comments from people on even on Twitter from public were, despite the, the challenges, the missed bins and where to go, were very positive because people do appreciate. I don't think actually that appreciation actually turns when it comes to elected members, into appreciation. I'm sorry to say that, but that is the case. I'll let John come in on some of the details and logistical issues. Yeah.
Thank you. I'll just let Councillor Lamb come back before we go to the officers. Councillor Lamb, please.
Yeah, what I noticed in that was Councillor Arif scooted round my offer, so I'll make it. Will you come to my ward and meet my residents and do the same in Pudsey, same in Armley and any other, and talk to them and make the same claims that you've made to me?
I'm happy to come to your ward. That's it.
Thank you. John, is it John or James? James, you want to come in, please?
Yeah, I'll go first, Chair, if that's okay, and then I'll just let John say a few words. I just wanted to make reference to the statistics that Councillor Lamb just referred to that Councillor Galton passed to him. Councillor Galton made the same reference to those statistics on Monday this week when I briefed him on this report, and there were statistics I've not seen, so it was difficult in that briefing to comment upon them. But I've now gone away and researched them, and just for clarity, I just think it's important for all members just to understand what's been said here. So statistics were provided for one particular day in terms of collections, and on that particular day, we listed the number of individuals who were off for various reasons. And yes, it is correct. There were only 3 people off with direct COVID symptoms that particular day. And there were other people off on sickness absence and other people off on annual leave. I think the thing to reinforce is that managing an operational service like this, we have a plan throughout the year in terms of how many staff we allow off at any particular given time in terms of leave. And at that particular time of year, the number of staff that we would normally allow, it being summer holidays, was the level that was on that particular day statistics. The challenge we had, and this comes back to the COVID challenges, we cover staff absent because we still obviously need to get crews out with agency cover, and overtime cover is the ordinary way of covering it. Unfortunately, we were in a period in August where we couldn't get any agency staff because the whole supply just wasn't there. And secondly, because of the new freedoms that had come about in arising from COVID restrictions being lifted, staff didn't want to work overtime. So we were in a very difficult position in terms of maintaining the routes. And yes, Councillor Galton might be right that maybe we could have cancelled leave, but would that have been a good thing to do for people who'd worked during a pandemic for 18 months with very little leave? So what we sought to do is manage the resource capability the best effect that we could, and we got out 95% of the garden waste routes plus 100% of the green and black routes. And I think it's just important just to clarify those statistics. I don't know if John wants to add anything specific about the Wetherby issue.
Thanks, James. Just very briefly, really, just to say that, that recognise what Councillor Lamb says in terms of we had some difficulties in Wetherby with the pandemic, as we're having a lot of wards, and the report doesn't seek to hide that we have difficulties. So we always do every year with the collection of refuse, and where we can, we work locally with ward members around solutions to those issues across all wards. We've met with all Wetherby ward members, and my area managers and team leaders continue to work really closely with Wetherby ward members, and particularly over the last 2 or 3 months, the view that I see is that we've dealt with a significant number of those issues that were being raised, and I'm getting very few issues escalated to me. In particular, 1 or 2 long-standing issues in Wetherby relating to access on a couple of difficult streets to access that have been resolved with ward members' support and help, and working with us on specific collection points. So I from my view, and I'll as usual, I'm very happy to meet Councillor Lamb and his colleagues outside of the meeting and discuss if that view is a wrong one, and continue to work with them closely on the solutions. But from where I sit, we do seem to be working well together in Wetherby with ward members, and closely and dealing with the issues that have been raised.
Thank you, John. I don't see any more comments on this paper, so I'll turn to the recommendations on page 311, and I take it everybody is happy with those recommendations. Thank you. So we move on to the economy, culture and education portfolio, and we're going to divide these papers up between us in terms of who leads on those. So item 13, which is Wetherby High School. I shall, if we could have one meeting, please. Item 13, Wetherby High School. I shall take a lead on, and despite the fact I once got booed by a group of Wetherby High School students when I said I attended Boston Spa School down the road, I am pleased. I've got over that. And I am pleased to be bringing this paper. I know it is a culmination. This comes at the end of years of work in terms of trying to find a solution to rebuild Wetherby High School within the funding available to us as a council and the funding available within Wetherby. And I'm pleased Alan Lamb is at today's executive board meeting, because I know it's been a good piece of work between the service and the Wetherby ward members to bring this forward. The plan is to rebuild the high school on a smaller site with capital receipts from land the existing school stands on to bring that forward, and other sources of local funding. The report today is seeking agreement for that approach, and there is an exempt appendix which goes into some more detail, and to hopefully we're aiming to have to rebuild the school by September 2024, and looking to with the agreement of the executive board, looking to seek agreement from the DFE in terms of their permission to release school land to take this forward. Like I say, I think it's been a good piece of work. I believe parts of the school date back to World War II, making it one of the oldest schools in Leeds. And again, between us, we've been able to bring this project forward. I won't say any more in terms of introduction, because people around the table have been far more involved than I have in this project who may want to add more to it. Councillor Lamb, please.
Yeah, well, thank you, Chair. And, well, nice to have a change of tone on this one. So just to clarify, had I have had a vote on this one, I'm pretty sure I would have been voting in favour of this. So I can give wholehearted support. From my perspective, it's 14 years of work to get to this point. I'm sorry, actually, Councillor Pryor's not here today, because there are many people to thank, and it's not often as opposition members we come. But Councillor Pryor has been really willing to work and engage with us as Wetherby ward members. It's a very ambitious, complicated, complex scheme, but it's absolutely the right thing to do. And it's taken a lot of faith on Councillor Pryor's part to actually give the political commitment. And I'm incredibly grateful that he has done that. And I really applaud him for being willing to work with us. And it just shows what we can do when we put our differences aside and actually get stuck into a difficult problem together to try and find a solution. There are a lot of other people to thank as well. I'd like to thank particularly Tom for showing leadership and supporting us, Councillor Blake previously, or Baroness Blake now, who for many years did try and engage and support, Neil and Martin, who have really gone above and beyond, and all of their teams, specifically Viv Buckland, who's been getting nagged about this by me for a long time. Enormous thanks to Jane at Jane Warner at the head of the table. I did warn her beforehand I was going to say nice things about her, which might not necessarily help her standing in the council, but nonetheless, it's thoroughly deserved. Her and her team have done an incredible job to work with us to find ways to bring this forward. And finally, to the staff and governors and pupils at the school, it even predates the Second World War. It's the site was the last landship in the UK, HMS Ceres, and parts of the building are still used for education purposes today. And it's a staggering achievement that such a good standard of education is still being delivered. And I'm so proud and happy to be at the executive board today when the council affirms its view that it is going to give those staff, pupils and governors the building they deserve, and it will make a huge impact to the wider Wetherby community. So it's, I just thank you all for being willing to do this for our community.
Thank you. Thank you, Councillor Lamb. Are any more comments on this paper? Councillor Golden, please.
Yes, thanks, Chair. I'm going to be positive as well. I think this is a good example of when people are given the free rein to do so, that creativity can happen when people are convened in partnership for a common goal. And as many of you will be aware, Wetherby High School and Royds High School were the last two big investment projects for high school buildings in Leeds over recent years, after Benton Park got its solution through an expansion of its pupil numbers. But for schools that didn't want to expand, the options were very limited. And I would like to have followed a similar, a similar model to that which has been applied to Wetherby. I know it's not all signed off and not everything, it still waits to be delivered, but I think with goodwill it should do. I'm a little bit disappointed that I don't think the same option is afforded to us anymore around Royds School, primarily because that school has now been academised by the government, and therefore the authority can't take a lead role in creating local community-based solutions. But I do hope that something can be done in terms of finding a solution for that last school now that we know that Wetherby is over the line.
Thank you, Councillor Galton. And obviously, Royd serves mine and Councillor Harlan's ward as well. And again, I mean, we could spend a good chunk of the afternoon debating the academisation process and the impact it's had. I don't think we need to do that, but certainly we're all committed to taking Royd's forward and looking now it's an academy, looking what options there are. On that note, there is an exempt appendix which we'll cover later. But I will take it that everybody is happy with that paper, and we'll move on to item 14, which Councillor Cooper is going to take.
Thank you, Chair, and I'm really pleased actually to be introducing this paper on behalf of Councillor Pryor, who can't be with us this afternoon. On the Great Jobs agenda and the Leeds Anchors Network, and let's hope we can keep the good vibes going at Executive Board this afternoon while we deal with the rest of the papers, shall we? So I think actually this is an excellent report, I've got to say, that's been brought to Executive Board today, outlining the work against the standards around the TUC's Great Jobs agenda and our ambitions around leadership role across the city as well. I think it goes into a lot of detail about the work that's happened as an employer ourselves, the role of on our council employment agenda, and the work that's gone on in the last year and a half, nearly 2 years now, and some really good detail around the future talent programme, around the green jobs agenda, and a lot of the work that's happening there. I think it's important to let Executive Board know, and it is in the report, that we as an organisation have paid the real living wage since 2015, and the report is requesting support for us to continue to do that. We've also worked with the anchor institutions around paying the real living wage, and now that represents 58,000 employees in the city who receive the real living wage through the anchor institutions work, which has been no mean feat. We know that there's still more work to do in the city to encourage other firms and employers to pay the real living wage, and that work will continue. So yeah, I'll leave it there for now, Chair, unless there's any other questions.
Thank you, Councillor Cooper. Councillor Golden, please.
Thanks, Chair. I was hoping to get a little bit more detail on future talent and green jobs. As I was pointing out earlier, I think the skills agenda is going to be one of the, it's the issue that needs to be progressed at pace from now if we are able to fully take advantage of the potential or the opportunities that there are for the green economy, but more importantly to make sure that we're not facing shortages in these sectors in the future because the capacity hasn't been created within our places of learning. And I see that the future talent is going to report back in spring because the work has already taken place over this winter. And I'm really interested in the green jobs agenda because it's one of the things that I've noted in a lot of reports is that we're not very good at defining what green jobs are or which particular sectors we are hoping to develop and generate and shape the market of in our own geography. And I just wondered if that is one of the consequences that will come out of the green jobs work stream.
Thank you. Eve, would you like to come in, please?
Thank you, Chair. My name's Eve Roothouse. I'm the Chief Officer for Culture and Economy at the Council. So just in relation to those two questions, you're right, Councillor Galton, the future talent work has been ongoing through the autumn and we've recently concluded the consultation on the future talent plan, and we're working in the first couple of months next year to form the plan and bring that to Council in spring. On the green jobs work, we're part of the Inclusive Growth Network, and through that network we have access to the Centre for Progressive Policy, who have just begun some work for us, around 20 days work, which we don't have to pay for as being part of that network. And they will be working with us to identify the opportunities and risks around the green economy and in exactly this space. So looking at the Leeds economy, its breadth, where the opportunities lie in terms of jobs growth, and where we might look for opportunities to be able to support manufacturing, for example, to pivot and respond to opportunities that arise from working towards net zero. And that work, we haven't yet identified when we'll bring that to Executive Board, because we expect there'll be a second phase of work after we've done that first piece with the Centre for Progressive Policy and we know more around it. But all of that will inform the next stage of our inclusive growth strategy, which you'll know runs until 2023.
Thank you, Eve. Councillor Cooper, please.
Yeah, in the report there is some detail on the green jobs agenda, and if you look at paragraph 19, 20 and 21, Councillor Galton, and it just says about the work done in the low carbon and renewable energy sector in the city as well, and the work we've done to decarbonise 38 publicly owned buildings as well, which has cut in the city's carbon emissions by nearly 4,000 tonnes. So that's just a bit of detail, but as Eve said, there will be much more coming in the spring. Thanks, Chair.
Thank you. Councillor Hayden, please.
Thank you, Leader. Yeah, just on the green jobs, we're not, Eve's absolutely right, and she explained it really well there in terms of looking at the city as a whole and what opportunities there are and what we need. But we're already working on green jobs, as Councillor Cooper's just, but also we are working with schools. So I recently spoke at a Greens Career event. We're working with Leeds City College and the College of Building, and in terms of partnership with Situ and with various different partners to bring those opportunities and to young people. And so the work is already going on in the city, identifying kind of what skills we need, but also in working with young people and schools to open them up to the idea of going into more sustainable long-term green jobs. Thank you.
Thank you, Councillor Hayden. I don't see any more comments on the paper, so I'll turn to the recommendations on page 338. I'll take it the board is happy with this. So I'm going to move on to item 15, the framework delivering major events in Leeds. I'll say a couple of words of introduction to this paper, which asks us to do two things. It's the adoption of the events framework, which will look at how we work about bringing major events taking us forward, and we all know that major events bring life to the city, they bring profile, and it brings visitors spending their money into the city. And I think as we move out of the COVID pandemic, particularly in hospitality and leisure sectors, that will be warmly welcome. There's a couple of events that are specifically referenced in here, which is asking us to agree to host a World Triathlon Series in next year in 2024, building on our really strong reputation for delivering great triathlon events, and particularly important for us as well, a very inclusive events in terms of the number of people, whether it's people new to the sport, or whether it is whether, you know, it was the 2021 event, which was held alongside the Para Triathlon event. We're looking forward to the Rugby League World Cup coming to the city, delayed due to COVID, and we'll host more games than any other city as well. That's the two parts to the report as it takes us forward. Again, very much a framework part is about how we'll work in the years ahead to continue to deliver world-class events in Leeds, and ones that, like I say, bring profile and investment to the city. As I said, it's a paper. I said I would introduce it. Eve, if you want to add anything to my words of introduction, please, before I open it up to the board. I think we're okay. Okay, any questions or comments? Councillor Lamb, please.
Yeah, thank you, Chair. You've set out a lot of the benefits of these events, which I agree with and support, but it's also important to me that they don't come without downsides. Roundy Park is a particular example. It's one of the jewels in the crown of the city, great place for events, but it has a significant burden on local residents whenever we do have an event. And we've got to make sure that we get the balance right of getting these brilliant events for the city, but that we also recognise and do something about the impact it has on the quality of life of local people. The second point I would make is just making sure and getting a reassurance in doing this that we're bringing in additional support for the service, and this isn't going to take and divert existing park staff who are doing important jobs already, and sort of putting pressure elsewhere in the service. So be grateful if we can have a reassurance on that, please.
Thank you. Again, I think you're right. You know, it's a point about evaluating the impact of events on local places, and making sure local people's views are taken into account. Myself and Councillor Harland had a resident when the Tour de Yorkshire came through Kippax that wanted to make sure the police were checking the speed of the cyclists on the sections that were a 30-mile-an-hour zone. So we always want to sort of take into account the views of local people. I'm looking down the table to see whether somebody wants to come back on the service impact points before I bring Councillor Golden in. James, please.
Yes, I can comment briefly, Chair. Thank you. So in terms of any additional events at Roundy Park, for example, we'd be looking at commercial related events, and in doing that we would be looking for that commercial provider to actually cover all of the costs involved, so we didn't have to divert any resources from elsewhere that would have a negative impact. So I can provide that reassurance to Councillor Lamb.
Thank you. Councillor Galton, please.
Thanks, Chair. I think it depends on the event. And I think this is one of the good things that the paper actually discusses, because it's great to get a higher profile for our city in the expectation that hopefully that recognition will deliver inward investment or a greater reputation, which will then have dividends later on. But sometimes a large event can feel like it is being delivered in the city for the benefit of the event host and for a very selected group of people that come into the city, take in the event and then disappear again. And I think it's really the most successful events are those which are the most inclusive. And I think the triathlon events, which have been mentioned, have made an effort in making sure that these aren't just events that happen in Leeds, they are events that Leeds can get involved with. And I know that that's hopefully the model which Leeds 2023 is hoping to engender when it's celebrating what we do in this city and hoping the outside world takes note. But it has been the tendency sometimes when we are involving some commercial operators that actually it's merely a transactional relationship between the city council as a big corporate body and another organisation. And for instance, I remember when we were talking about Test cricket and how important that was to Yorkshire County Cricket and for Headingley Stadium, and we were told it brings £30 million for investment into the city. But it always felt to local residents that that money wasn't coming their way. It was going into the big brewery corporations that ran the pubs around the stadium. And it actually caused more issues for them than it did benefits. And I do think that when we are curating this marketing, that we are aware of needing to make it something which is attractive for the community which hosts it, rather than just the corporate partners who sign the deal.
Thank you. I think that's, again, in terms of looking at the options we take when we choose to host or not, or bid or not for events, so those are really important considerations to take into account. And again, I look again the work around the triathlon, around the Go Try development work that happens all year round. As a good example of that, you have an event that puts us on the world stage in terms of coverage, but also, you see people of all ages trying a sport for the first time and get involved in a sport for the first time. Again, that community stuff is really important. Come to, if anybody comes to Kippocks, I know it's a bit of an out of the way place to get to, but screwed on the wall of the library and community hub is the award we received for being the best village on the Tour de Yorkshire route because of the work we did, not 1 year, but 3 years. The most satisfying one was the one we beat Garforth in that competition. But it is, if it is getting that engagement and looking what you can, as well as the high profile and the big events, it's what we can generate for communities, that interest and that lasting impact, that lasting impact of people working together, sometimes differently in the ways they did before to achieve that. I think if we can get all that right, it is the right recipe for this, and it's certainly something, again, when options are available, we're very mindful of. On that point, don't see any more comments from the board on that paper, so I will turn to the recommendations on page 372, and I see everybody is happy with those. So we move on to Councillor Arif's paper, please, item 16.
Thank you, Chair. Chair, I'm pleased to present the Leeds Parks and Green Spaces strategy. Public parks and green spaces provide a fundamental role in making cities attractive places to live and visit, with parks in Leeds hosting over 45 million visits a year, and 88% of local park users describing spending time in them as either essential or important to their quality of life. Given their significance, it is important that a strategy is in place and to ensure parks and green spaces are managed in a way that maximises their potential to benefit local people and the environment. The aim of this strategy is to set out a vision for our parks and countryside service and the actions that will be undertaken by the service to deliver that vision over the next 10 years. The strategy was developed following an extensive public consultation process, which identified a number of priorities. The details of the public consultation process are available at Appendix B. The proposed vision is to provide the best parks and green spaces in the UK, based on feedback from users and knowing the fantastic parks and related facilities we have in Leeds. I believe that this is an attainable goal, which will make a significant contribution to the council's ambition to be the best city in the UK. There are 8 priorities proposed in the strategy: quality, climate and biodiversity, access for all, culture, child-friendly, working with communities, financial sustainability, health and well-being. For each priority, specific aspirations and the actions that will be undertaken to achieve them are set out in the strategy document. 109 actions are identified in total. These will be delivered over the next 10 years. By focusing on the priorities, the Parks and Countryside Service will be able to support the Council's 3 pillars. For example, the climate emergency is addressed in the strategy through an ambitious tree planting scheme involving planting 50 hectares of woodland each year. Evidence shows that providing good quality, accessible parks and green spaces benefit public health and well-being, something I'm sure we all had personal experience of during the pandemic. Evidence also shows that having access to good quality green spaces can reduce health inequalities. Inclusive growth will be delivered by continuing to improve our visitor attractions, for example, Tropical World, and investing a proportion of the resulting income in play facilities at parks where other funding isn't available, which are often more deprived areas like inner city areas, for example, in my ward, or by providing opportunities for children from areas of deprivation to visit these attractions. This is an agenda that I'm really keen to drive forward. Of course, the Parks and Countryside Service can't deliver excellent parks and green spaces without working with communities, ward members, and a whole range of other partners. Which is why working with communities is also highlighted as a priority in the strategy. I'd like to take this opportunity to thank all our volunteers, friends of and in Bloom groups for their vital contributions. Parks are a fantastic free resource that everyone can use and enjoy. In recent times, particularly during the pandemic, people have come to value urban public green spaces and recognise the importance. Our parks and green spaces provide opportunities for leisure, relaxation and exercise, but are also fundamental to community cohesion, physical and mental well-being, along with climate change mitigation and local economic growth. We are keen to ensure that public green spaces in Leeds continue to deliver these benefits, and this strategy will help achieve that. Thank you.
Thank you, Councillor Arif. Are there any comments on this paper, please? Councillor Lamb, please.
Yeah, just a quick bit of clarification. So my understanding is there was already a plan in place to reduce the number of flower beds and planting in parks. So the question, does this supersede that plan? And are you still going ahead with reductions in flowerbed planting? And the concern really is in some areas, like my other parts of the city, where we've got town and parish councils, brilliant in Bloom groups and things like that, then they'll always make sure everything is looking pristine. Our council team does a brilliant job, but if we're going to reduce things, you might end up with a 2-tier effect, where some parts of the city see reductions in planting and things like that. So can you give us a reassurance about that?
Good afternoon, Sean. Would you like to come in, please?
Yes. Hello, everybody. Sean Fletcher, Chief Officer, Parks and Countryside. So the plan is that we're not actually reducing the number of flowers that we have in our parks and green spaces. What we are doing is changing the type of flower that we use. So we're moving away from traditional bedding plants, which probably don't have the benefits of wildflowers in terms of attracting pollinators and other valuable wildlife. So the plan is to actually increase the number of flowers we have through using wildflower areas, more naturalistic planting. So we're still going to have some formal bedding. We're going to keep the formal bedding in our cemeteries, on our war memorials as appropriate. We're also keeping quite a lot of the formal bedding in our community parks. But what we're also doing is introducing wide-ranging pictorial flower meadows, wildflower meadows across the city, which I hope will transform the feel and look of the city in a more positive way.
Thank you, Sean. Councillor Golden, please.
Thanks, Chair. I tend to have a lot of correspondence with our park section, which is sort of in inverse proportion to the numbers of people within it. I know that it's been particularly challenged over recent years in terms of the number of staff it has and in certain quarters their retention, because I know a lot have been attracted to nearby authorities that have a higher wage rate, for instance. But on the other hand, it's a stage where parks are at their most popular that they've been for a long time and are very much well appreciated by the populations that they serve. The reason why I've been in correspondence with parks a lot, though, is it's very hard to actually identify a plan for many of our parks where we as local community representatives can effectively engage the wider community into influencing that plan, but also, given the depleted staffing resource, to hopefully enable it to happen. And sometimes it causes conflict from those people that do have a high interest in our green spaces and don't seem to be able to influence outcomes. And in particular, I'm going to focus on one aspect in the report, which I think is really useful, and it's around accessibility. Because one of the things that we want to do as local councillors, for instance, in Rothwell, is to ensure that all of our community parks and all of our natural environments can be reasonably accessed by people with a physical disability, at least, and we want to look at other kind of disabilities and try and engage with that. We found it very hard to understand who it was that we would talk to enable that to happen within the council. And we do have disability specialists, but within Parks and Countryside, it didn't feel like there was anybody that was really, genned up on the issue. And I'm glad to see that in this report, it points to accessibility as being really key to the future development, but it's very scant on detail of how that will happen. And all I'm going to say here is, please involve your local councillors to better engage your local community, because there are plenty of people out there that want to be involved. So, for instance, we wanted to do disability access audits on our local parks. We wanted to make sure that in our natural environments, we could at least guarantee that 20% of the space could be accessed with a wheelchair or a mobility scooter. And there's no one to engage with at the moment. And I would like to see that curated so that we can take that forward. Thanks, Chair.
Thank you, Councillor Golden. We'd like to come back, Councillor Arif, please.
Yeah, just to say, yeah, absolutely. Of course, it's really important that, our parks are accessible by everybody. But if you look at one of the actions, actually, and it is a short-term action, it does say to develop a process for auditing the accessibility of our sites and to have a plan on a page for sort of each community page. And I'm sure your comments will be taken on board and elected members will hopefully feed into that.
Just as a supplementary, what is short, medium and long-term in this plan?
Do you want to come in, Sean?
Yeah, so short term, we're thinking within 2 years, realistically. So if this strategy is approved today at Executive Board, we're looking at refocusing some of the part of the services within the Parks and Countryside service to help us deliver these outcomes. So there's 8 specific actions, for example, on accessibility. We're making arrangements to work with partners. So the Parks Forum are very keen to undertake access audits. That includes all the friends groups, etc. Want to look at their own site and pull together that. Of course, we do the LQP where we specifically measure access, and we've got a firm commitment to ensure that all our parks and green spaces meet, or certainly our community parks meet level 7 for access on there. And there's a real firm commitment to provide a plan on a page for every community park over the life of the strategy. And that is something that we're going to hit the ground with immediately as soon as this strategy hopefully is approved.
Thank you, Sean. I don't see any more comments on this paper, so I'll turn to the recommendations, or the recommendation on page 390 that we approve the strategy. I take it that everybody is in agreement with that. That's great. Thank you, everybody. And we'll move on to Councillor Hayden's portfolio, please, and item 17.
Thank you, Leader. So item 17 is seeks approval to commence 6-week consultation, public consultation on main modifications recommended by the independent planning inspector, who was appointed to examine the remitted part of the Leeds site allocation plan, commonly referred to as the SAP. And it's and I'd like to take this opportunity to thank the whole team on the work that's gone on for many years on the SAP and on particularly on this remitted part of it over the last few months. Particular thanks to Martin Elliott for his work and his the time spent and his intelligence when being examined by the independent planning inspector and other people in the team as well. So I'll leave it there. Thank you, Leader.
Thank you, Councillor Hayden. Are there any comments on this paper, please? Councillor Lamb, please.
Thank you. Just very briefly, Chair. First, just to echo the thanks to Martin and his team for the brilliant job they did through the inspection. I think we said most of what we needed to say in the last council meeting, so I'll spare you that again. But I would just like on record to reaffirm our group's view that we absolutely support the 36 sites being put back into the green belt. But our strong view is the Barrowby Lane site should also be going back into the green belt, so at the very least until there's a proper employment review.
Thank you, Councillor Lamb. Councillor Golden, would you like to come in, please?
Well, just wanted to express our support for those sites that are mentioned here to go back into the green belt formally, which was the intention anyway, and was one of the reasons why we had great what's the word? Great support, reassurance that the council was going to achieve its goals in doing that. My group is less opinionated on the last site in question, given that it has significant employment potential. But we will still be reserving our position on the paper and saving our comments for council.
Something to look forward to. Thank you, Councillor Galton. Are there any more comments on this paper? I don't see anybody wanting to speak, so I'm turning to the recommendation on page 478 that we approve the public consultation on this and item B. So I take it, I picked up Councillor Galton's comment. I take it everybody else is happy with that. Thank you. And we move on to the last item, Councillor Hayden, please.
Thank you very much, Leader. So this is the integrated rail plan for the North and Midlands and the outcome and implications for Leeds. So as the title says, it sets out the key issues of the integrated rail plan, which was published on the 18th of November 2021, so last month, and the specific implications it has for Leeds. It also has around 8 recommendations, half of which, or at least half of which, seek clarity and actually use those words on certain aspects of this plan and what it means for Leeds and West Yorkshire and the North in general, or the North East in general. So I will, hopefully everyone's had a chance to read it. It gives a lot of the history and context of this integrated rail plan over the last 10, 11 years, which consequently is the same age as my children. So, hopefully if we get greater clarity, we can have some way forward as they grow up and enter adulthood, and hopefully it won't take that long before we can move forward. But I will leave it at that, Leader. Thank you.
Thank you, Councillor Hayden. Are there any comments on this paper? Councillor Lamb, please.
Yeah, it's just a brief. I mean, we are where we are, aren't we? I think the key thing from the point we're at is making sure we really quickly address the Leeds station capacity issues, because it's nearly impossible to develop any other plans until we increase the platform capacity. And in terms of what we can do locally, that's what we can do. And I think that's one of the key things we've got to get on with.
Thank you, Councillor Lamb. Councillor Golden, please.
Thanks, Chair. I was hoping for a little bit more from Councillor Lamb. I would appreciate the Conservative group's opinion on the plan which has been put forward, which was expressed by the government as being even better than that which was originally planned. For my group, I appreciate personally that one aspect of it has been confirmed as not going forward in its original plan in terms of the HS2 eastern leg, which will be a relief to many of the people who were on its approach route into Leeds city centre through Rothwell and other areas. However, one of the things that this paper does highlight is that there is no clarification as to what the alternative is meant to be to that route, or indeed whether or not this council might actually be deciding that the original route was the best and should be pursued once more, or whether or not actually that is actually a decision for the council, because it's so opaque, the instruction which has been given for the money which the council is meant to be spending on reviewing that route into Leeds. And I've been told that it's actually ultimately the DFT that will be taking that investigation forward. I'm looking around because that's the information I've been given. It doesn't look like anybody else is confirming that. So it doesn't really feel like it's a devolved decision either, even if the money is sort of being given to us, but is then being spent by somebody else, which doesn't seem to be quite right. It's very disappointing that the east-west connectivity in the plan has been basically dismissed, that the local authorities were wishing to pursue, and the amount of actions in this paper, as was pointed out by Councillor Hayden, where we still need to clarify so many things, is really an indictment of the quality of the report we got back in the integrated rail review. Considering its delay, you would have thought it would have been subject to ever greater refinement, and it just seems to actually have delivered ever greater confusion in terms of what it is that the government wants to achieve, or indeed how it thinks it's going to enable us to achieve our plans for northern connectivity.
Thank you, Councillor Golden. I think, you know, I've heard Councillor Hayden describe this as a disintegrated rail plan. It does feel a little bit, I'm a little bit in terms of the pieces of the jigsaw that seem further scattered in terms of our approach. And again, I thought it was important that the first executive board, after the publication of the plan, we did set out in a structured way the information and clarity that we felt we needed before moving forward. I'm going to ask Tom to come in, please, and hopefully try and be helpful on some of the questions that Councillor Galton raised.
Thanks, Leader. Yeah, I think we're all having to sort of choose our words carefully on this one. It is a setback for us because we've planned the city for 10 years on the basis of a national scheme coming forward, and it's now looking like it's changed, and we've been in this position before as well. And I think the main thing for all of us that we're trying to achieve from here is that we don't get into this position again, and we can have a much stronger, more transparent and joined up, if you like, partnership with government with our regional partners and ourselves on making sure that we can deliver real improvements to transport in this city and between other parts of the region and wider, because Leeds plays that pivotal role on the east of the Pennines economically and in labour market and housing market terms. And if 50% of the trains are late going through Leeds station, then it means that that has knock-on effects right across the country, and that's the position we're in at the moment, and that's why the point about capacity is really, really important. The other thing about capacity is that in whichever way you the government chooses to fund the enhancement of that capacity has a direct knock-on effect to the way that we plan the city, not just in the city centre, but the impact that has on, for example, housing across the city. So we have got to get this right next time. The direct answer to Councillor Golden's question is that it is DFT who are in charge of that 100 million. We had a meeting with them and Network Rail and others this morning where we've been trying to encourage the partnership approach that I mentioned, and we're keen to move forward with that work as quickly as possible. But what we need now with there are some good things in this, mass transit, hopefully moving forward with a commitment for services to be running this decade is something that in other times we'd be celebrating about as a city and as an exec board and as a partnership. But because it's in the context of all the changes and the lack of clarity, as the paper makes clear and as Councillor Hayden very clearly articulated, that's the problem we're in. We thought we were going to be able to move forward once we got this integrated rail plan in terms of how we link to London, how we link to our other cities on the east of the country, and how we link across the west of the Pennines. We aren't, unfortunately. So that's the piece of work that needs to happen as quickly as possible. And we are encouraging our colleagues in DFT and Network Rail and others to do that as quickly as possible.
Thank you, Tom. Are there any further comments on this paper? I don't see any comments, so we shall turn to the recommendations on page 611 over to 612. I take it everybody's happy with those recommendations. Great, thank you, everybody. That brings us to the end of the public part of the meeting, so I will just wish everybody a very Merry Christmas and hope 2022 is better than 2021, and thank everybody for attending.